Simon Blake, and I'm delighted to have been invited to speak at this Global Impact Conference with you today. I'm Chief Executive of a social enterprise, Mental Health First Aid England. MHFA England is based here in the UK, and we have a vision to improve the mental health of the nation. Our specific focus is on workplace mental health, and we focus on the workplace because so many adults spend so much of their time in the workplace, and by building mental health literacy, building understanding about mental health in the workplace, we also know that that ripples out into the community and into families as well. So it's really important to start by saying that we all have mental health. Often when we think about mental health or talk about mental health, we actually think about mental illness or about people who experience mental illnesses. But we all have mental health. All of us have a brain. And the World Health Organization defines mental health as being about being able to manage with the ups and downs and stresses and everyday realities of life. And of course, what we know as we've gone through COVID-19 is that this is an exceptionally difficult period for many. That whilst mental health is always a cause, poor mental health is a cause and consequence of inequalities. What COVID-19 has done is amplified and exacerbated those inequalities, as well as created more. Over the last 18 months, more and more people have experienced anxiety because they've experienced job insecurity, they've experienced financial insecurity, they might have experienced precarious housing, or they might have had worries about their health, or indeed have experienced bereavement of a loved one. All of those things increase the likelihood and the risks associated with poor mental health. In the UK, the Centre for Mental Health estimates that 10 million more people will need mental health support as a direct result of the pandemic. That's 8.5 million people, 8.5 million adults and 1.5 million children. And that's against a backdrop of which we already had significant issues with mental illness and poor mental health that weren't being adequately addressed. And so it's increasingly important and more urgent that we address mental health as part of our efforts to achieve the Sustainable Development Goals and indeed to build back and move on through the next stage of the pandemic. But whilst everybody's talking about COVID-19 and the impact of that on mental health, it's also important to recognise that there's a parallel pandemic going on. That over the last 18 months, we've recognised the significant impact of systemic racism, and that we know that racism and all forms of oppression also impact on mental health. So when we're thinking about mental health, it's really important that we're also thinking about those wider inequalities, the experience of racism, the experience of misogyny, of transphobia, of homophobia on mental health as well. So at Mental Health First Aid England, we're part of a global network of organisations that are delivering mental health first aid training. Mental health first aid training was first developed in Australia and has gone on over the last 20 years to spread across the world, and there are over 4 million people that have been trained in mental health first aid. So what is it? Mental health first aid is a training programme which helps people to develop a better understanding about mental health, about their own mental health and well-being, as well as that of others. It enables people to understand signs and symptoms of poor mental health, and also the impact of mental health stigma on people's ability and willingness to get help and support. The training also builds confidence in having conversations with people about mental health and about mental illness, and identifies a 5-step process by which people can provide information and signposting to other forms of support, including clinical support. What mental health first aid isn't, it doesn't train you to be a psychologist, a psychotherapist, a counsellor, or a clinician of any sort. It simply enables you to have those conversations and to signpost into other forms of support. At MHFA England, we focused on providing training for mental health first aid training in the workplace, because we know that most adults spend a significant amount of their adult life in the workplace, and that the workplace can also be a place that can cause lots of stress and all sorts of issues related to both work or outside of work can manifest themselves in the workplace. And so by providing that training in the workplace, we enable people to change workplaces, provide support in that context, but also that ripples out into the wider family and community as well. In the UK, we know that poor mental health costs workplaces between 42 and 45 billion pounds. And that was before the pandemic. And we know with the impact of the global pandemic that that's going to be even greater now. So it's really important for businesses that we address mental health from an economic perspective and from a moral perspective. We also know that people want to work in organisations where they feel trusted, where they feel valued, and they feel as though their mental health is supported. So for workplaces up and down the country, it's absolutely business critical that they pay attention to the well-being of their workforce. And MHFA England has been doing that work with people for over 10 years and has worked with over 20,000 businesses. In training the people within those businesses, what we've seen is people both taking on a mental health first aider role and providing support to people when they've needed it, but also to take on a wider role of championing mental health, of holding a mirror up to the organisation to identify where things can be done better, and to try to build cultures in which mental health and performance sit side by side and really help to fuel one another. Time and again we hear of people who are mental health first aiders, people who've been supported by mental health first aiders, and by managers and leaders who say that mental health first aiders have made a really significant contribution to changing cultures and to making mental health a more acceptable conversation in the workplace. A research study a couple of years ago found that more than 80% of people asked thought that mental health first aid in the workplace had improved the number of conversations that were happening and in the amount of support that was provided for people when they need it. So at MHFA England and the organisations that we work with during the pandemic, the focus on workplace wellbeing became even stronger. For those people that were working from home, were expected to take their work into their homes, it became really, really important that we understood how people were doing, keeping them connected and supporting them to be able to keep well, keep motivated and to keep delivering. What we learnt during that period have actually got a huge number of lessons for us as we move forward as well. So what did happen and what did we learn? The first is that we needed to create the biggest flexibility, the greatest autonomy, and enable employees to feel trusted and valued. Whoever they were, they needed to believe that they were valued and recognised and respected member of the team. We know that we needed to help people to connect, to stay connected to their teammates and to the wider organisation, but that we also needed to enable people to disconnect. With work being in their home, people could find those boundaries between home and work more fuzzy. And in a culture that's already always on, it's really important to enable and encourage people to disconnect as much as it was to stay connected. Organisations encourage teams to take responsibility for doing social connection themselves, so that people did virtual quizzes, virtual meetups, virtual meditation, virtual wellbeing, whatever it was. And those things, as we move into the hybrid, are still things which we need to keep going. Just because we've got used to working in these unusual circumstances, it doesn't mean that we should take our focus and our energy off some of those activities. We also know that it's important to physically check in on people's mental health, to ask people over and over again about their well-being, to make sure that people know that you care about them, care about their well-being, and to encourage them to take steps, whether that's about taking their holiday, whether that's about ensuring that they're not working at the weekends or in evenings or outside of their regular hours. That really, really important that those ongoing, constant conversations about mental health were happening. Also, when people are really working hard, important to celebrate success. So again, none of these things are things which are new. They're all things which were important before the pandemic. But in the context of different ways of working, became even more important for us to really focus on them. Some work that MHFA England did, some research showed that over a quarter of people had not had any engagement about mental health, any conversations about their well-being throughout the pandemic, and that those who did felt more connected to their workplace. As we look to the future, we've got a huge amount which we've learnt about mental health in the workplace, both pre-COVID but also over the last 18 months. We know that there's going to be a significant amount of uncertainty and that there is inevitably going to be lots of change, and we've got to find ways to embrace and to encourage our teams to feel able to embrace it as well. So talking about our psychological contracts, our employment contracts and our well-being at work has to be a feature of every workplace across the world. We also know that we've got to really try to make sure that everybody, regardless of their gender, their sexuality, their identity, their ability, their disability, feels as though they are welcome, valued and respected in their workplaces. It may sound obvious, but too many people don't. And if we are going to really be a workplace that promotes well-being, then we're going to need to make sure that we address those inequalities which are so prevalent in wider society as well. Mental health and well-being needs to be a board level issue. We know that well-being and performance fuel each other. So often we talk about performance and well-being balancing one another, but if we can think about them as fuel, then it really is absolutely imperative that at senior levels, at the most senior levels within the organisation, people are recognising that relationship and really investing in and supporting mental health. We know that we need managers to be trained and supported so that they're able to do their role in supporting the mental health of their teams. Over half of people in the UK who are managers have not had any training in mental health. We can't expect managers who are absolutely vital to supporting mental health to do so unless they've had the training. Mental health first aiders play a really critical and important role as part of our whole organisation approach to supporting well-being. And then lastly, we need to make sure that we recognise that we're part of a community. We're part of an ecosystem that supports mental health. As workplaces, we're not islands. We're absolutely connected into mental health and wider health services, to community, to churches and wider support services. And we make sure that we build those bridges and those connections and facilitate access to support and other sources of help when people need it. So it's been an honour to be able to be part of this Global Impact Conference. Thank you for enabling me to talk about mental health and to think specifically about the role of workplaces in promoting mental health. Mental health is an issue which has become something which more and more people are talking about, and it's absolutely vital that we continue that conversation, that we continue sharing and we continue learning if we're really going to address mental health as a social justice issue and make sure that it absolutely reduce stigma and reduce the inequalities and improve the mental health for all.